are. I'm very pleased to start this conversation today with some good friends and guests, special guests, I can say, from many parts of the world. The Brazil Africa Institute is very pleased to receive important people that are very busy in this pandemic situation that I know during this 1 hour, their ideas, their experiences will be able to help people around the world. I'm João Bosco Monte, the president of the Brazil Africa Institute, and I'm here in Brazil right now in Fortaleza, and I have the honor and the privilege to welcome Dr. Tedros Adhanom, the Director General of the World Health Organization. Dr. Tedros, thank you very much for making some time to be with us. I have Dr. Shisana. She's the Social Policy Special Advisor of the President of South Africa, President Ramaphosa. It's very good to have you with us, Dr. Shisana. I have also Dr. Jorge Chediek. She's the Director of the Office of the South-South Cooperation from the United Nations. Thank you very much. And also, I have the privilege to welcome Dr. Roberto, Cláudio, the Mayor of Fortaleza. So, the situation that we are facing now, the coronavirus pandemic, has highlighted the weakness of the public health in many places. And I have here some numbers. March 16th, we had 169,000 cases in the world. Today, we have 3.8 million cases in the world. So how possible it will be for this number to increase? Is it possible? Is it possible to stop? What is the role of the scientific and technical cooperation that will be able to ask us to reinvent ourselves? This is the core of this discussion. And also, we have the possibility to interact with the people on YouTube that are watching us, so don't feel shy to send your questions to the participants while they talk. I would like to start now the conversation to Dr. Tedros. What's the role, Dr. Tedros, of the scientific and technical cooperation to minimize or to stop, to decline this the number of cases around the world? So, the floor is yours.
Thank you, João Bosco Monte, President of the Brazil Africa Institute, and Dr. Jorge Chediek, Director of the UN Office for South-South Cooperation, and Dr. Shisana, Social Policy Advisor to the President of South Africa, and Mr. Roberto, Cláudio, Mayor of Fortaleza, Brazil. Excellencies, colleagues, and friends. First of all, thank you so much for inviting me, and I'm really glad to participate today. And I would like to express my appreciation to the Brazil Africa Institute for your commitment to fighting the pandemic and saving lives. Since WHO declared a global health emergency in January, as you said, COVID-19 has spread throughout the world, disrupting health, economic, political, and social systems. One of WHO's most important roles is bringing countries together to fight the pandemic. For example, we have brought countries together to share experiences and lessons learned. We have brought together thousands of experts to analyze the evolving evidence and distill it into guidance. And we have convened researchers to identify priorities from all over the world. We have launched a large international trial to find answers fast about which drugs are the most effective. And we have brought together a consortium of countries and partners to accelerate the development and equitable distribution of vaccines, diagnostics, and therapeutics. And we have also shipped millions of test kits and tons of protective gear all around the world, focusing on those countries who need our support most. And we have trained more than 2.5 million health workers around the world since COVID started. And we have worked with tech companies to fight the infodemic and much more. In all these ways, the pandemic has highlighted the critical importance of national unity and global solidarity. No country, regardless of size or resources, can manage COVID-19 alone. Close partnership between countries is essential for building transparency, trust, and coordination, and for the governance and financing of emergency preparedness and response. This virus will be with us for a long time, and we must come together to develop and share the tools to defeat it. It has also underlined the importance of strong national and subnational health systems at the foundation of global health security and universal health coverage. While COVID-19 has affected all segments of society, it also highlights the increased risks that the most vulnerable and poorest face during a crisis. This includes refugees, people living in conflict, and communities in post-war settings. Public health crises like COVID-19 jeopardize hard-won development gains and hamper progress towards achieving the Sustainable Development Goals. At this critical juncture of the pandemic, all countries and stakeholders, including those from the private sector, must work together to ensure that no one is left behind. While progress has been made in health security preparedness through instruments such as international health regulations, gaps remain and there is still wide variance in national preparedness. It's critical.
Dr. Tedros,
yes.
Let me just stop you because you mentioned something very, very unique about the participation of the private sector. I'd like to ask you to hold this for a while. I'd like to address now the question, or one question. Dr. Roberto Cláudio, who is the mayor of one important city in Brazil. And I'd like to ask you, Dr. Roberto Cláudio, and pointing what Dr. Tedros mentioned, and I will come to you, Dr. Tedros, please just hold a second. What is the importance of the combination, therefore, between the public and also the private sector to fight against this pandemic? What's the experience that we can bring from Fortaleza?
Hi, again, it's a real pleasure to be part of such an honored debate. I'm going to address the answer right now in order to save some time for the debate. But I would say that here, the state of Ceará specifically, I cannot tell if it's a rule, nationally speaking. We have created, by the leadership of the state governor, a state committee, several different organizations, even private organizations. They have a seat on such committee, which has the purpose of building consensus. We know that social isolation, for instance, has some socio-economic consequences, and it's very useful and I would say practical if we have the private leaders sitting within this committee, see the data, observing the reality of the epidemics, its impact, in order to have their support. But speaking about private sector, I should also underline what we have faced here in Brazil. The lack of a health-related industry in Brazil has made Brazil very much dependent, relying on importation. That has shown us as a country one weaknesses in order to respond effectively to a crisis such as this. Brazil doesn't produce many of the equipment and supplies that to face such an outbreak. So I would say that the most valuable contribution that the private sector can make is get involved on the development of healthcare products in the country.
Very good. So thank you very much for your contribution. And now I come to Jorge, Dr. Jorge Chediek. We have, the world is very big. I know that you have been traveling too much. Of course, in these days you are isolated in New York, so you cannot travel too much. I don't think you can even go to have some jogging at the Central Park. If you do, please be safe. But how can the world, how can countries can contribute in dialoguing between themselves, using, for example, the program that the United Nations system have for this pandemic. How the UN system can help the cooperation between countries from the south, but also bringing possibilities from the north.
At the global level, the Secretary General of the United Nations prepared an action plan for the response of the United Nations system. It has several pillars. One of them is the health pillar, which is led by WHO, and I take the opportunity on behalf of all the people who work for the UN to salute Dr. Tedros for his leadership. The second is a humanitarian dimension. As Dr. Tedros also said, there are a lot of vulnerable populations, and this crisis, unfortunately, is creating tremendous problems in terms of nullifying some of the advances we made in terms of poverty and advances against hunger. WFP, the World Food Program, forecasts that at least the number of people in extreme hunger, starvation, will almost double by the end of this year. The International Labour Organization estimates that over 300 million jobs will be lost, affecting mostly the people from the informal sector and others. And also there is the socio-economic dimension. So we have health, humanitarian, and socio-economic. The socio-economic is critical too, because they have to be taken in conjunction with health, namely that the activities we restart in terms of the economy are compatible with the epidemiological advice we receive from health, but at the same time creates the most in terms of opportunities for the poor and for the people who need it the most. The good news is that there are some examples that are coming to the fore of countries that managed to achieve a degree of epidemiological control, like the Republic of Korea, and also managed to keep the economy from falling very dramatically and are able to restart. From the South-South perspective, which is the area where I work, there are a lot of very important experiences that are very relevant to other developing countries, as in many occasions we cannot copy or emulate or have the similar resource base from developed countries to respond to the pandemic. And we're working with many UN agencies, including WHO, to utilize our platform that is called South-South Galaxy as a vehicle for experiences to be shared. And we're very proud that the UN system in this time, that multilateralism has to be reivindicated because we're fighting a common universal enemy, is trying to step up to the challenge and help the world confront this terrible enemy.
All right. Thank you, Dr. Jorge, for your vision about what's the role, what's the situation now, looking internally to the UN system. Dr. Shisana, I spoke with you recently, and I mentioned to you that I saw some doctors from Cuba that arrived in South Africa to help the local government to bring some solutions or some support. How you see their work in the Cubans' doctor, and how this could be emphasized for other countries in the South? And give me the idea of South Africa.
Yeah, let me say that, first of all, thank you very much for inviting me to participate in this very interesting discussion. South Africa has got a massive problem with regard to the public health system. We do not have as good doctors that are dealing with communicable diseases the way that they should be. I understand, of course, the fact that we rely a lot on the World Health Organization. We've got excellent epidemiologists that are able to deal with the kind of problems that we have. We've got nurses that can be able to do quite a lot of work, but they are not enough. It was for that reason that we had to go to Cuba to see if we cannot bring Cubans here. Cubans are excellent in the area of primary health care, especially when you talk about going to a household type of service that you should provide. Most of our healthcare system is based on health facilities, in clinics and hospitals. Now, the Cubans are the ones that are able to go to the households and be able to create a system, a health system within the community. And I think that many countries have benefited from Cuba's assistance by exporting many of their doctors to go in and help. We appreciate that very much. In terms of how South Africa has dealt with the coronavirus, I think we've done very, very well. I mean, we started with the lockdown and making sure that we restrict people from moving all over, and so there is also social distance, between people, making sure that people stay within 1.5 meters from each other. We have also come up with a new example, the masks. Everybody is required to wear a mask before they can actually get out. And we're told that we must stay indoors, and they enforce the staying indoors, which is very, very good in the sense that those people who don't want to follow the instructions can actually be arrested for failing to do that. And the reason for that is that we're trying not to spread this virus. We have had very good results so far. We've been able to flatten the curve. Since we started on the 5th of March up to today, South Africa has got less than 8,000, people that are infected with coronavirus. We have less than 148 people that have died from the coronavirus, mainly because we've taken the public health measures of testing, tracing, and then also, ensure that those that are tested and are sick are actually taken to the healthcare facilities. So we're quite comfortable with what's happening. And thanks to WHO for assisting us with all those public health approaches that have been propagated, and we've really used them very effectively in South Africa. Thank you for that.
All right, Dr. Shisana, thank you. And I know that the situation is getting better in South Africa, and I know President Ramaphosa is working very tough and with his office to bring some solutions. Dr. Tedros, you are every day being watched in the news. So every day when I turn on my TV, I can see you at the TV, and I think people everywhere in the world. Maybe your family it's very worried about what people are saying about you as well. But also, I'd like to bring my personal impression about what the job of the World Health Organization is doing. We are impressed that we just received the information from Dr. Shisana. But let me bring to you one question that I need to hear your voice. How can vulnerable economies in the world, right, and societies can be prepared to achieve better results in public health? How you think, you are an expert, you are dealing every day with doctors, with people from around the world. What do you think that should be the real direction that the public health can bring to have a solution for the problem, but also to minimize this big pandemic problem?
No, thank you. That's a very important question. As you know, as WHO, we have been alerting the world about pandemics or epidemics. I remember even saying that it's not if, it's when, and we knew it was coming. And in February 2018. There was a government summit in Dubai. We were looking at that message actually we had from WHO in 2018. It looks as if this thing, we knew that this thing was going to happen. But there was no need, to be honest, to not predict this, because we knew at that time, the reason we were saying this was we knew we were vulnerable. We knew we were not prepared. We knew the world is not prepared, especially countries with weaker health systems. And as you know, we are as strong as the weakest link. And for pandemics, global solidarity that starts from investment in preparedness is very important. So for countries to address or to prepare for future pandemics, our advice is to invest in preparedness. Do you know how much money we're spending now because of this pandemic? A lot. Not only investment in health, but our economy is going into recession. We're paying a lot of money as a result. This could have been prevented if we had invested in preparedness when the time was there. So, be it for the developing world, even we have seen that even the developed countries are vulnerable because they didn't have public health, strong public health in place. So the advice, be it for the developing world or for the developed world or for both, is to invest in primary health care, to invest in preparedness. When I say public health, you can see what's happening now. Many countries are not doing case finding, testing, isolating. This because the system is not prepared to do that. Even we have seen that in some African countries, actually, there is better preparedness with that regard. Although countries said contact tracing could be difficult because we have lots of cases, I remember during the Ebola serious outbreak in DRC, which is almost over now, we were following up or contact tracing 25,000 people a day in the middle of a very unsafe place, North Kivu. So the short answer to your question is investment in preparedness, especially in primary health care, and with that in public health, not only in developing countries, in developed countries too. Even developed countries are not immune to this. And they have seen that, or they had many of them had surprises. And to do this though, especially in developing countries will need support. And that's why we said there should be a global solidarity in preparedness. And we need to support each other to prepare the whole world. But the preparedness starts by investing at the national level, each and every country. But there should be a global solidarity to prepare each and every country. And that preparedness in each and every country brings global preparedness and minimize the vulnerability. So we need to use this opportunity now, the COVID, in order to move quickly and use the momentum to prepare, to strengthen our preparedness now and for the future.
Thank you very much, Dr.
Over.
For your contribution. Before I come to the next participation, I'd like to also...
So, Dr. Bosco, I was told that I will speak and leave because I have another meeting. I was actually waiting. I was told I would be here for the first 15 to 20 minutes and then I will be allowed to go because I have another meeting. If you allow me, and with respect also to other panelists, if I could go to the other meeting, I would really appreciate it. I have a colleague, Dr. Jawad Mahjour, who can take my place and continue with you.
Okay, Dr. Tedros, I understand.
He is actually the Assistant Director General for Emergency Preparedness. He's the right person, and he can join you for the rest of the panel.
Before you leave, I just give the floor to the participant here to congratulate you, to say a few words before you leave. But you are very free to leave. Thank you for your presentation.
Thank you so much. Thank you.
The last words, Dr. Tedros.
Thank you very much for what you are doing, Dr. Tedros. As members of the UN family, we are very proud of the work WHO is doing, and led by you and also by all the teams working in the field. Having been a UN person for almost 30 years and working in over 10 countries, I know how important WHO is, and I want to thank you and congratulate you for your leadership.
Thank you so much.
Dr. Roberto, Cláudio.
Dr. Tedros, real pleasure to meet you and also to share the debate with you. And also like to invite you to meet President Fortaleza. We are real pleasure to have you here. But mainly, I'd like to congratulate you and WHO for the great job you have done.
Thank you so much. Thank you.
Dr. Shisana.
Yes, I'd like to say thank you very much, Dr. Tedros, for the excellent work that you're doing at WHO in terms of guiding the world, putting together the guidelines, and ensuring that you brief the world in terms of what the situation is. We in Africa are very excited about the fact that we have such a very competent leader that is actually helping us in terms of dealing with this coronavirus. Without WHO, I think the world would go very much astray because we need to be coordinated, we need to be led. Someone was asking me, who would be the best leader in the world in terms of dealing with coronavirus? I said, look no more. Look at the UN, look at WHO, look at Dr. Tedros, because he doesn't have that baggage this way or that way. He's dealing essentially with the problem that we have all over in the world. Thank you for the work.
Thank you, my sister. Please pass my greetings and appreciation to President Ramaphosa. His support means a lot to me, and he has been supporting ever since this COVID started. And my appreciation to him. Please pass my greetings to.
All right.
Thank you.
Dr. Tedros.
Okay, thank you so much.
And I look forward to see you soon, hopefully in Brazil, in Fortaleza, or again for your great job.
Thank you. See you too. I hope this will be behind us soon and we will meet again. Thank you so much. Thank you. So, George, would you like to come? Okay.
So before we continue, I'd like to mention that we have spectators or participation from many parts of the world. We have from Egypt, we have from Portugal, from India, we have from France. Merci beaucoup pour votre participation. We have participation from Kenya, from Argentina. Muchas gracias por la participación de los argentinos también. Of course, we have participation from Brazil. So we have now a possibility to address something else. And I come to Dr. Roberto Cláudio before coming to the new participation from WHO. Dr. Tedros mentioned something about solidarity, and he mentioned the word solidarity more than once. How do you think that solidarity is important now in your situation as mayor of one big city? And sometimes the government itself cannot solve all the problems. But if you bring the core work from private sector, as you mentioned before, the civil society, but also from other state representatives, how do you see solidarity as an important issue for this discussion to bring solutions?
This is for me the best side of being human. So at these moments of suffering, of shortage of resources, even some Brazilian communities shortage of basic supplies such as food, we have seen communities getting together, communities helping each other, private entrepreneurs also becoming donators. So it's very nice to see such an effort, such solidarity. Since Brazil is a pretty large, it's almost a continental country, so it's a big size country. We have seen that mostly within the state level, but even national companies and even national NGO movements have helped to develop such a humanistic dimension of being human. We have seen that very often in Brazil at this point. However, also, Professor, I would like to highlight the need of leadership and the need of good values and good examples coming from the public side. We definitely need at this point leadership which is based on the best values, a leadership that can influence behavior, and leadership that can integrate and coordinate different efforts. It's not easy, for instance, to implement social distance or even lockdown in a state because it brings consequences, sometimes negative economic consequences. So it's very good to have someone who has good reputation, who can listen to the scientific recommendations, who can clearly and transparently speaking about the problem, about the data, and guide and lead the population through the right track, through the right way. Unfortunately, I should highlight that part of the Brazilian problem at this point is caused by a distracting message coming from the federal government. At the beginning of the problem, when the scientific community, governors, and mayors were really worried about what was happening worldwide and also preparing their own responses, we were listening distracting and confusing messages from the federal government. That definitely did not help in the beginning of the outbreak in Brazil. Fortunately, it seems that more recently, the new Minister of Health has defended the social distance and the lockdown as the most simple, most effective, with the best cost-benefit measure to prevent that. So I would say that besides the solidarity that has risen from the bottom to the top, it's very important as well to have good leadership at the public side, and also at NGOs, at national and international agencies, such as WHO has done in order to guide public officers, but also in order to positively affect the population behavior. I would say that's the critical point here. Although we have implemented social distance measure, although we have mass media communication, although the data has been shown daily at the TV networks, we still struggle getting people to be kept at home. And I would say that most of that is because we have a confusing message coming from the federal government.
Thank you, Dr. Roberto, Cláudio, for your vision and your experience as mayor of one big city in Brazil. I'd like to address now this question to Dr. Shisana. You are in front of President Ramaphosa every day, looking to bringing to him good experiences, good cases from around the world, right? So what is the best practices that you can see, not only in South Africa, that can bring solutions for the problems or the weakness of the health system in South Africa, but for example in Africa? How is your vision about this?
First, let's say that there are many countries that have really not COVID when it happened. As soon as they realized that there was a problem, they worked hard to flatten the curve so that they are able to prepare for the deluge that is going to be coming in some of the countries. They saw that there was a problem. They had a very serious lockdown, and that lockdown was hard. It made it a point that people cannot move out of the Bay province and go elsewhere and spread it elsewhere. Consequently, they've been able to reduce a lot of infections. They had a flatter epidemic around the country, but contained it within a place. In South Africa, obviously, when we realized that we've got a problem, we started introducing some really strong measures. We had a hard lockdown. We enforced it with the police. We ensured that we brought in the defense force to come and help, people. Of course, there were a few incidents here and there that we're not happy about, but overall, they've done a very good job in making sure that they are assisting the country. We ensured that we've got border controls so that people do not move in and out of South Africa and start importing cases, because most of our cases in South Africa came from outside. So by really closing the borders, we're really able to contain it. And the same thing has happened in places like Zimbabwe. They've made it a point that they've got a lockdown. In fact, most of the African countries that have dealt with this thing very effectively, like Rwanda, they really locked down the country. And then once they locked down the country, we then started doing the clear public health approach. That public health approach of being able to screen, to identify the people that need to be tested, send them for testing, trace the contacts, quarantined or isolated the people that we need to, treated those people that we needed to put in a hospital. So that's important that we use a public health approach within the lockdown. It's not just simply that you're locking people down and they sit at home and therefore there's nothing else that needs to be done. Now we've come to introduce some other measures. Those are economic measures. Those measures are strategic in the sense that they are trying to enable the business to start, but to start on a gradual basis, making sure that every employer is responsible for assisting the workers in terms of making sure that they've got masks, they can wear the mask, making sure they decontaminate the place. As soon as someone is infected, they decontaminate the whole place, they close it, decontaminate, and make sure that it doesn't spread within the facilities. We're still at an early stage because we have now moved from a system that was developed in other countries like New Zealand, where you actually have several levels that you need to deal with, the alert levels. So the alert level of 5 was a strict lockdown. We are at alert level of number 4. Number 4 means that you've got to you ease some of the lockdown restrictions. You allow people to start going to work. You allow people to go out and exercise. But very interesting, something that you might want to take somewhere else. We cut down on alcohol sales. We said no alcohol sales, no tobacco sales. Consequently, we saw massive decline in mortality due to violent means. Very few people died. In fact, if you look at our figures on mortality in South Africa during this period, we've dropped down our mortality due to non-natural to about 40% decline, which is huge.
Okay, Dr. Shisana.
We can listen to you, Professor. We cannot listen to you.
Oh, I'm sorry. Okay. Thank you very much for letting me know. Sometimes the connectivity is not so easy. But I was saying thank you very much, Dr. Shisana, for your information and for the perspective that we have in South Africa. But I'd like to address now a question to Dr. Jaoud Mahu. I'm sorry if I'm not pronouncing correctly your name. He's the regional director for Eastern Mediterranean from the World Health Organization. Thank you very much, Dr. Jaoud, for your participation. We have now in front of us a major problem. And I heard more than once Dr. Tedros mention that we need to be prepared, we need to work properly now, because we may have a second coronavirus in some places. So we are now ready. Are we ready for what's going to happen? If we are not ready, how the public system should be ready? What they should do now in order to be prepared for the possible second wave of coronavirus? Please.
Thank you very much for this very, very important question that all countries now around the world are working on. First, let me say that the decision should be at the country level and sometime even at the district level, because within the same country, situation may differ from a region to another region, and you may have regions where are highly affected and others less. And the decision should be taking into consideration the situation, and the decision on lifting or leasing the lockdown, or what's so-called the shutdown, should take in consideration the situation there. Second, we recommend to the countries, to our member states, not to do it in one shot, but to do it gradually, step by step, and monitor and evaluate the situation after each step to go to the next step. And this is the best way to protect what we gained through the lockdown, because the lockdown was helpful to gain time and also to prepare to respond to the COVID, but also to implement public health functions that Professor Shisana beautifully mentioned. We need to be sure that capacity for detecting, capacity for contact tracing, capacity for isolation, and capacity for hospitalization is there, and to make sure that is always there to prevent and to take care of any cases who may appear after the lifting of the shutdown, and to be ready to take any decision in real time. And without this, we cannot monitor the situation and take the action. One word about what we learned from the COVID-19. If there is only one lesson that we learned, is that we need a whole society approach in this pandemic. No sector can work alone. The government role is extremely important to lead, but we need the community to be aware. We need the community to be prepared. We need the community to participate. We need the private sector to participate in, and we need the civil society to be prepared. I think this is a strong message that we need to go out from this pandemic, which is without also society approach we cannot achieve and we cannot succeed. And this is what Dr. Tedros all the time speak about. Solidarity at the global level between governments, between sectors, but also solidarity within the countries through implementation of whole society approach. Over.
All right, thank you very much for your contribution. Dr. Jorge Chediek, I'm coming to you now with a question, and I don't know if I have the answer, but you may have the answer. We need to be creative in these days. There is no money. The countries, the government, national, local government, they don't have capacity, financial capacity to solve the problem. How possible is the world, in terms of international community, to bring solutions to solve not only the problem of the COVID, the pandemic, but the economic impact that we are facing now?
Thank you for the question, Roberto, and this is a real, very important issue. Because sometimes when we're in the middle of the pandemic, we tend to concentrate on the epidemiological and the health aspects, which are extremely serious and need to be addressed, because if they are not addressed, then the economic and the social dimensions cannot be taken care of. But we cannot lose sight of the terrible social and economic damage this pandemic is causing worldwide. In a short 3 months, we are probably creating the conditions to losing the gains that we made of 10 years in poverty reduction. We're probably going to miss the gains that we made in hunger reduction over the last 10 years. Countries will emerge from this crisis with a very bad fiscal situation, very complicated monetary situation, very complex trade relationships, because of many of the productive change will be severe or disruptive. So what is the approach to this? Number one, countries have to be created at the national level in terms of how they handle their public finances, how they support the local governments, Prefeito Roberto, Cláudio, and they should also be flexible in their approach. Second, in the whole society approach, we have to call for the generosity of those who can give more in terms of within the society. Fortunately, in many countries we're seeing a very large rise of voluntarism, the development of social food banks and other type of responses that show that many societies are responding to the challenge. However, we will need a global response. Global response meaning that the issue of the debt, the stock of debt that the countries will emerge, crisis with, have to be dealt with. We should not retreat into protectionism, utilizing as a pretext the shortening of the supply chains. Also, we should restore investment, both local and global, in public infrastructure and also in job-generating activities. And for that, as it was said several occasions, we need a global community. All the countries of the world can share resources and experiences to optimize how these additional resources can be channeled. The perspectives are good in some areas, as Dr. Tedros was mentioning. We got some good coverage of funding for some of the health emergency dimensions, but at the same time, the Secretary General launched an appeal for originally $2 billion, which yesterday was increased to $6 billion, to address some of the immediate humanitarian effects of the emergency, and only $1 billion have been pledged at this stage. And we're worried that many of the traditional countries that provide aid, and they should continue to provide aid, will emerge with a very serious financial situation, fiscal situation that might lead them to reduce their commitments. So we have to really advocate for doing the best at the national level, but ensuring that the global community continues to act as such and becomes very creative in how to handle these problems. This was not a business as usual crisis. It's not a business as usual policy menu that we have to undertake to respond to this crisis, and will need also creative solutions in terms of the economic and social response to the crisis. Over.
All right. Thank you, Jorge, for your very sharp and direct message. I come now to Dr. Roberto Cláudio. You use two hats. Your hat as mayor of Fortaleza, but also you are a medical doctor. You are now in front of this crisis as someone who knows how to deal and how to suffer, how difficult to suffer with this. So being a mayor and a medical doctor, how do you see the role of the scientists, the universities around Fortaleza, where you live, but also in Brazil, but around the world? Is it possible that you can knock the university doors to help, to bring some support for some solutions for your administrations? You have this. Do you have any specific cases that we can listen from you?
Yes, and it's important to emphasize that for us, actually for the whole world, we are dealing in a great part with the unknown. So we only get the complete perspective of this pandemics afterwards. So I would say that I repeat that here in public speeches, that the position of public officers and even local academicians should be at first humble enough to learn from others, to learn from other international experiences, and mainly to learn from science, good quality science that has been produced during the pandemics. We are learning as we are living the pandemics. So that's why it's so critical to base our decisions on the most reliable scientific data that we have available. Also, as we have done here, based on WHO guidelines and protocols, it's important to have an explanation which can hold itself based on science recommendations that can be simply explained to the people. at the state committee that I mentioned before, that's led by the state governor, that I'm part of that as the city mayor, we have the universities being part of that. So there are some trials being done at this point, using some different pharmaceuticals here. Also, the federal university is involved in developing a sort of ventilator. It's a different model of ventilator. So it has showed us that as a nation, we definitely lack investment on healthcare, on the development of technology, on the development of vaccines. So that, as I mentioned before as well, that has shown us how dependent we are as a nation on others' technology, and as well on the importation of healthcare equipment and supplies. So definitely there is no good policy without good data. There is no effective public healthcare policy without science, without scientific evidence. So that's what we are looking for here in the state of Ceará and also in the city of Fortaleza. Although we don't have as much papers, as much products in Brazil as we'd like to, as we need, we have relied on definitely on the universities, on the academic world to base our decisions here in Fortaleza.
All right. Thank you, Dr. Roberto Cláudio, for your impression and information as mayor of Fortaleza. Now I come to Dr. Jaú. Dr. Tedros, he mentioned something earlier, that the world was not prepared for the pandemic. In January, when he met and he had a meeting with some authorities, this was something was not a prediction, was not something that he saw previously, but he said that the world was not prepared. Now that we are seeing so many cases, at the beginning of this conversation, I mentioned that the world has 3 million cases in the world. How can we face the days to come without having the preparedness in our agenda? What is the message that we can hear from the WHO from this perspective?
Thank you very much for this very important question. And Dr. Tedros mentioned it several times since he took office that the top priority for the world to deal with outbreaks and epidemic is to be better prepared at the country level, but also prepared at the global level to deal with the global issues. When the COVID started, of course, many countries were not prepared to deal with these countries, and also we didn't have at that time global mechanism to ensure global coordination. Although WHO is leading, but we are missing some global mechanism, like, for example, access to goods, like access to supply, that are very important. We are now seeing a great solidarity and great movement in this direction. Our hope is that this dynamic will remain after the COVID and just after we start to prepare better our countries. Every country should have a preparedness plan and implement it properly with the necessary resources, not to be surprised. And we saw it during this pandemic that even countries with mature health system, they were to some extent surprised by the magnitude of the pandemic, and they didn't cope with for example, hospitalization of cases in some hospitals. We are taking great lesson learned from this pandemic, and we need to use them to better prepare countries, but also to the global level on dealing with this kind of basing on some principles that Dr. Tedros always says solidarity, whole of society approach, and prepare during peacetime to get ready to deal with any event at local, national, or global level. Over.
All right, thank you very much, Dr. Jawood, for your statement and your ideas. I'm so sorry. I'm looking out to my assistant, and they're saying that we are just about time to close, which is not so fair because we'd like to hear more about your ideas and what possibilities of solutions we can bring out of this discussion. But of course, because of the agenda, we cannot stay here the whole day. But before we leave, I'd like to address to you one final question, and you have only 1 minute to try to answer, right? What lessons we can learn from this tragic situation, disaster situation, and how can we avoid surprises for the health system worldwide? So I start with you, Dr. Jorge Chediek.
The lessons are that we have to be prepared for the unexpected. It's not that unexpected as I was discussing this issue with Dr. Tedros in a meeting I had with him in November of 2018. So it was always in the map, the possibility of having a pandemic. The situation is that we have to prepare for the unexpected, and we have to always keep a principle of global solidarity and global collaboration to confront these challenges. We have to think differently to deal with a different problem, and we are doing some very good things about it, and I think there are many others where we can further improve, and I hope we do along the way. Thank you.
Good. Dr. Shisana, please.
Okay. There are 3 things that I think we've learned from this. One is that take health budget to become very, very important. Budget for health. Don't look at health as just consumption expenditure. Look at it as something that's necessary to protect the economy and to grow the economy. Number 2, make sure that you've got surveillance capability. We must train our people to really know how to deal with infectious diseases from a public health point of view. And the final point I just want to mention is that invest in universal health coverage. Use the resources in both the public and private sector together to make sure every person who lives in the country can have access to health care. Over to you.
Good. I know it's not easy to bring the recipe in 1 minute. I'm trying to get to have as much as possible. Dr. Roberto, Cláudio.
Everything from a Brazilian perspective, definitely build an emergency preparedness and response system that we don't have one. Secondly, I would say that a more solid and homogeneous surveillance system nationwide. And third, empower local healthcare systems through private healthcare. I would say that these 2 matters would get us more well prepared for the next one.
Okay, good. Thank you. You mentioned empower local healthcare system and workers. I think it's very good music for our ears. Please, now I come to you, Dr. Jawood. Please.
Thank you very much. I think colleagues say the most important things. I will just add 2 words. The first one is empower the communities, because they are very often forgotten in our preparedness mechanism. And without communities, we cannot deal with this global event. Second message is we need more and more global solidarity to deal with this kind of global event. And solidarity between countries is also highly needed. And thank you very much for this opportunity.
Okay, thank you, Dr. Jaud, for your final words. And I heard the word solidarity many times, not only from Dr. Tedros, from Dr. Jaud, but I think this is something that we have to keep with us after this conversation. We cannot do things alone, and now I call the Afghan pervert. We need to go together to go further. We have to be together to go further. So we cannot face this very important and crucial moment doing things alone. So the world is not alone. So we have to be very cautious and prepared to work together. And preparedness is something else that I heard too much during this conversation. And I think we need to be prepared for what is coming tomorrow. The situation is not over. It's not finished. We need to be very sure that we have to work together and we need to be prepared. So thank you very much for your participation. I'd like to thank you, Dr. Tedros Adhanom. I know he needs to leave and he left because of his duties. But also thank you, Dr. Jaud Maju, for your participation. Dr. Roberto, Cláudio, thank you very much for bringing your perspective as a mayor of Fortaleza. Dr. Jorge Chediek, thank you very much once again for having this moment, giving us this moment, the opportunity to listen your ideas. But also, I'd like to thank you, Dr. Shisana, for your time, for your participation, but also bringing a possibility of understand what South Africa and the countries around South Africa are doing to have this pandemic as something that we need to face and have it over. Thank you very much once again. I'd like to thank the audience. We have many people from many parts of the world, and this is available on YouTube. So when you want to see the ideas again, please feel free, go there in our channel, Brazil Africa Institute channel. And also, if you want to subscribe to our newsletter, please feel free to go there and just send your name and you will receive all the information. Once again, thank you very much, and I look forward to see you again soon. Bye-bye.